Presiding Officer. I have previously called for the veil of leave-in inquiry to be extended to cover all C. diff cases in Scotland, and I continue to make that call today. Each time there's an outbreak, we realise that lessons learned in previous outbreaks haven't been passed on. Each hospital appears to be working in a vacuum with very little central advice and guidance. It's hugely frustrating that there's not a clear patient pathway to deal with this. Government need to issue clear advice to boards and their staff on the best practice during an outbreak to ensure that this is dealt with appropriately and efficiently. And let me be clear, health professionals are dealing with this deadly infection daily, and most do it in a way that halts the spread, but they never make the headlines. We need all outbreaks to be dealt with in this way, and that requires more information and support from the centre. And I appreciate that the Government will wish to take on board the findings of the veil of leave-in inquiry and have them reflected in central guidance, but this should not be used as an excuse not to issue clear and accessible guidance now. However, it is a reason to extend the inquiry to the rest of Scotland. This information needs to be made widely available both in hospitals to patients and visitors, and indeed within the community. While the risks of spread should be more easily dealt with in the care home sector, given the use of single rooms, there are still issues for staff, clients and visitors to bear in mind in order to stop the spread. And we also have anecdotal evidence from health professionals that some care homes do not deal adequately with infection spread, and this leads to emergency admission to hospital and the subsequent spread of infection while the problem is being diagnosed and dealt with. There must also be clear information for the public as to what to do to stop the spread of infection. And this is very much the case in my region, where hospitals tend to cover large areas and visitors may know several people in the hospital and visit them all at the same time. And as Jackie Bailey mentioned the website, and I looked at the Government's website as I was preparing my notes for today, and I found it quite easily, given that Spice had given me a very easy link to the site. And I looked up to see what advice was available to members of the public, and I looked in the frequently asked questions section and clicked on what can I do to prevent infections. And this answer started off well enough. It said, the most important thing to do is to wash and dry your hands. However, this was followed with, in brackets, or use an alcohol gel if provided. The use of or implies that the alcohol gel is an adequate substitute for washing your hands. It's not. C. diff is not killed by alcohol gel, and this is the advice on the Government's own website. Our hospitals have a profusion of bottles of alcohol gel, giving a false sense of security. This security is backed up by this misleading information on the Government's website. The only way we can deal with hospital-acquired infections is to wash our hands when arriving, leaving and between visits to different patients. We should also use the hand gels provided for additional protection against MRSA. And until this message is common knowledge, hospital staff are fighting a losing battle. In addition to advice and guidance on best practice being available to patients, they should also be informed of outbreaks in the wards in which they are placed. This information, together with additional guidance on hygiene, will be helpful in allowing patients themselves to tackle the spread and also to remove some of the concern that people face when they're going into hospital. If they're assured of open, honest information, they will be much more at ease with the prospect of being hospitalised and the risks that involved. There also needs to be the same emphasis on cleaning in hospitals as there is in general patient care. We've heard of reports of patients having to use soiled toilet facilities and very ill patients attempting to clean up after themselves without equipment or disinfectant. There needs to be a reactive cleaning service available to nursing staff when a patient soils a communal area, and it's unacceptable that that patient should be left to try and clean up. Neither is it acceptable that this falls to already overstretched nursing staff. We need specialist trained cleaners to be available to provide a rapid response. We also hear of families being asked to wash soiled linen, with no advice on how they should do this to eradicate infection. While families may wish to do washing for loved ones, they should be advised against it. And if this means that the hospital needs to provide night clothes and gowns instead of the patient's own during an outbreak, then that's what should happen. And in some hospitals, patients' laundry is given to families in sealed bags that dissolve in the washing machine. Again, we need good advice and investment in good practice. The Government's purchase of steam cleaners for hospitals was welcome, but this intervention can't sit alone. When patients are diagnosed with infection, the risk is apparent. C. diff can remain on hospital surfaces, and unless these surfaces are cleaned sufficiently with disinfectants containing bleach, the threat of infection spread remains. This also has to be applied to the hospital beds and cabinets of infected patients that might be moved between wards and single rooms through the treatment of that patient. On recovery, these items should be deep cleaned in the same way as their rooms are, because moving a patient's furniture back into a ward will only spread infection. I'm conscious that everything I've said today is about protocol, systems and guidance, and these things are imperative. However, we can't afford to lose sight of the individual stories behind this debate. Those who have lost loved ones, those who have been struck down by these infections, their feelings, their dignity and their pain. Each statistic bears a human cost, and we should never lose sight of this as we strive to eradicate these deadly infections. Each of these families are entitled to inquiry, and they are being failed by this Government.